Fat transfer is a very exciting procedure that we have many years of experience performing. It entails the harvesting of fat from your body, usually with a very thorough liposuction. Part of the fat transfer procedure is to improve your body shape through liposuction. The fat transfer procedure entails performing a liposuction with suction that is less aggressive than usual to minimize the damage to the fat cells. I follow a special technique to try to minimize damage to the fat, and we centrifuge the fat in a special manner to concentrate the fat and not have too much fluid in it. The fat transfer can be done to many different areas. The most common in our clinic is what's called the Brazilian butt lift, and what it will do is to enhance the shape, perkiness and roundness of your buttocks, and that together with the shaping effect of a torso liposuction will give you a tremendous improvement in your body shape and a lift and roundness in the buttocks area. The fat transfer to the buttocks is really a procedure that is minimally painful. There's really no issues with recovery. You will read on the internet that you shouldn't be sitting on your buttocks after a procedure like this. That's nonsense. I tell my patients you can jump on your butt right away. The fat will not move anywhere if it's placed correctly, the way we've done thousands of cases, and there's very, very good results with this procedure with no recovery issues, but for the liposuction that gives you some soreness on the recovery, but soreness that is easily manageable with just ibuprofen and remaining active. Another area of fat transfer that we commonly do is to the breast. Now, I explain to my patients that there's a very significant difference between fat transfer to the breast and breast implants. They are completely two different procedures. If you come to me and you're asking to get fat transfer to the breast and you are already in great shape and you don't really need liposuction, it just doesn't make sense to do a fat transfer to the breast, because the main benefit of doing fat transfer to the breast is performing a very nice body sculpting. So if you already have a great shape and you are not interested in shaping your body anymore, well, it doesn't make sense to do fat transfer. Now, the other issue, unless you have fat in other areas like the thighs or arms, okay, then we can discuss fat transfer. But the main issue here is understanding what your main goal is. If your main goal is shaping of your body, and secondarily using that fat to enhance the shape and volume of your breast, fat transfer is a great option. Now you have to understand, we cannot go from an A to a double D with fat transfer. We usually can say we can increase your size 1.5, 2 cup sizes on average. So if that's your goal, body sculpting and 1.5, 2 cup sizes, that's a great way to do it with fat transfer to the breast. Now, if you are a marathon runner, you are planning on losing 30 pounds after your procedure, please don't consider fat transfer to the breast. Most of the fat in your body is going to go, including the one that I transfer to your breast. So the reality, there's limitations of the fat transfer to the breast, in which case breast implants is a much more logical and straightforward solution and cheaper solution. Now, if you have significant body fat, you are interested in getting nice contouring and secondarily increase moderately the size of your breast, this is the perfect procedure. I advise all my patients that when we do fat transfer to the breast, there's a resorption rate of fat that is on the range 30 to 40% of the fat gets reabsorbed. I usually have extra fat, and I encourage my patients, if they are going to do, let's say, a torso procedure first, torso liposuction, to do the first fat transfer, and if months later they want to enhance the shape of their legs or arms, then we can do that second procedure and do more fresh fat transfer to the breast. There's some controversy about using frozen fat. In my personal experience, it works very nicely. We have a special protocol to prepare this fat, and we save it under very special, strict, sterile conditions. And we have seen very good results with frozen fat that we harvest the day of the first liposuction. Now, the downside to frozen fat is that we have seen a little bit more incidence of oil cysts. An oil cyst is fat that is not incorporated into the breast tissue, doesn't get enough blood supply, so a cyst forms. I always tell my patients after fat transfer to the breast, if you feel a nodule, a lump in your breast, don't panic, just come to us, we do an ultrasound, and usually we can identify immediately if it's an oil cyst, and with just little local anesthetic, I can drain that cyst very easily in a 10-minute procedure. The incidence of that, I've done about 500 cases of fat transfer to the breast, and I have about 25 cases of oil cysts that can be removed very easily as an outpatient simple procedure. I have 2 cases of fat necrosis in the breast after fat transfer, in which cases, in one case I had to remove with ultrasound assisted liposuction, remove the thickened hard fat that calcified almost. In the other case, the patient wanted implants, so I just went in, removed the area of fat necrosis and put her implants in, and everything was solved. Why these 2 patients developed fat necrosis, I don't know. Maybe the amount of fat that was placed was a little bit too much for that breast that didn't have enough blood supply to nurture that fat, and maybe that was the reason, but that's a very uncommon occurrence. If you lose weight after you fat transfer to the breast years later, well, the breasts are also going to shrink. Depending on how much fat you lose, your percentage of fat in the breast will also decrease. So you always have to consider those pros and cons when you decide to go for a fat transfer procedure. Another great place to do fat transfer is to the face in patients that have grown older and have lost volume in their faces. We do what's called the FAMI, fat autologous muscle implantation. It's a procedure where we plump up with your own fat the 32 muscles in the face, and we create very nice, youthful results, minimal bruising, minimal swelling on recovery, very easy, and it's a very easy way of rejuvenating your face without significant downtime. The hands, another area where patients complain about getting older, is an area where we can do fat transfer with awesome results. A little edema or swelling in the hands after that, but usually the results are beautiful and very quick recovery. The calves is another area where ladies that want to improve the shape and size of the calves, we've done fat transfer to the calves in multiple occasions with very nice results. The only thing here is we advise you not to get a pedicure within the first month or 2 after the fat transfer to the calf, because that would be a source of contamination of that fat that we transferred. So in general, fat transfer is a great procedure. We have a great experience here at Ciao, and our results are really outstanding. But you have to understand the benefits and possible complications of it. If you are going to undergo any of these procedures, you are going to be given a very thorough consent form that is going to be sent you by email, so you can read them at home. On your pre-op evaluation, you are going to be asked about any concerns you have with the consent forms, and once you understand 100% your consents, what you're getting into, what the possible complications and risks are, that are minimal in general, but there always are complications in surgery. Once you know that, then we will do the procedure for you after you are 100% sure you don't have any further questions about the possible risks and benefits. Thank you.